Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of inferior intravenous pyelogram. Intravenous pyelogram can be diagnosis of horseshoe kidney. Horseshoe kidney can be diagnosed based on the intravenous pyelogram. In the intravenous pyelogram, you will see that there is low-lying kidneys are seen, and these kidneys, low-lying kidneys, are present close to the vertebral column. Then you will see that the vertical axis through the kidneys point towards the lumbar spines. See, you see that this is an intravenous pyelogram, so the kidneys will be seen something like this. So you see that the kidneys are closer to the vertebral column and they are seen at around lumbosacral spinal level. Okay, next, the main orientation of this kidney is directed posteriorly to each renal pelvis, with the lowermost calyx pointing caudally and medially. See, each calyx will be, actually this gives the appearance of hand joining sign because there are two kidneys and they are fused to each other. It is something like two hands are joining with each other, so that is hand joining sign is seen. Similarly, here in the horseshoe kidney, you will see that there is flower vase like appearance is seen because of these curving ureters. These show a flower vase like appearance also. So these two names are important because the on intravenous pyelogram you see that the ureters are as though they were joining the hands, so we see hand joining sign. Similarly, due to the high insertion of the ureter towards the midline, you will see the presence of flower vase like appearance is seen on intravenous pyelography. Then you can also do angiography. This angiography is mainly done before surgery. This angiography is done before surgery. Why? Because in angiography, here in the horseshoe kidney, the blood supply is unpredictable because we really don't know from where the blood supply is, because the lower poles of the kidneys of both the kidneys are fused. So as a result, we do an angiography. It is not needed usually right now. It is done before surgery, but now nowadays we do this helical CT scan can be done nowadays because angiography is an invasive technique. So we do a helical CT scan is better done than angiography in present situations.
thank you and thank you for watching.